Welcome to Healthcare Logic for Growth, the weekly show where we talk life sciences and healthcare in general, things like clinical operations, research, commercial strategy, market analytics, and what it takes for anyone in healthcare to grow in a sustainable way. I'm Eric Marr, your host, the founder of Life Science Logic and a current Life Science Association board member. So whether you're building a biotech, running a rural hospital, leading a home health agency, or shaping healthcare policy, this show is for you. Hi there, and welcome back to Healthcare Logic for Growth. And thank you for joining me on our 8th of 10 episodes in our initial series, focused primarily on policies and insights that impact life sciences in 2026. Today's episode, what healthcare startups need to do to win and why so many fail. Look, if you work in healthcare like many of you listening do, you already know this industry is very different. I've certainly seen it change, and it is different than it used to be. A good idea is not enough. A strong pitch, it's not enough. And even a good product or service is not enough. In healthcare, startups have to prove they solve real problems. You're going to hear me say that consistently over the next 20 or so minutes because it's critical. They have to demonstrate that they can improve outcomes. They must fit into the way care is actually delivered, and they have to prove their payment model will work from the start. There are things to consider, right? Additional things to consider, but these are foundational for today's purposes and for many of the startups that are out there. That's why healthcare startups are so exciting, but also that's why it's so very hard. Today, I want to break this down in a very simple way. First, we'll look at the 5 things a healthcare startup needs to do to be successful. Again, there's other things, but these are pillars, right, as you move forward as a startup. Then we'll look at 5 most common reasons healthcare startups struggle and maybe even fail. And along the way, I'll use real companies to show what success looks like and what happens when things go wrong. So let's get into it. Healthcare is not like any consumer marketplace or technology. In consumer markets, a company can grow fast by just getting attention. In healthcare, attention is simply the beginning. The real test is whether a company can pass clinical scrutiny, regulatory scrutiny, operational scrutiny, and of course, financial scrutiny. That means a healthcare startup has to answer some very hard questions, and they have to do it early. Things like, does this solve a real problem? Does it improve care or reduce cost? Does it fit into a provider's workflow? Does it work for the payer, the employer, the health system, or the patient? And can the business survive long enough to scale? Those are all questions that matter. We'll come back to some of these through the course of this episode. Success factor number 1, solve the problem. As I mentioned, one of the very first things a healthcare startup needs to do is solve a very real and painful problem. Not a hypothetical problem. It's not just your interpretation. It's not just your opinion. It's not a nice to have. It's got to be a real pain point that affects customers, that affects outcomes, cost, access, or efficiency. And when I say customers, I mean patients or those that serve patients. A good example is Omada Health. They focus on chronic care support, especially conditions like diabetes and hypertension. Those are expensive, common, and serious problems. They are long-term burdens for patients, employers, and health systems. That matters because the strongest healthcare startups do not start with the technology. They start with a specific problem and look at their solution set and whether or not it can solve the problem. So ask yourself, what is the problem and why does it matter? If that answer is vague, the startup is already at risk. To maintain success here, founders need to keep listening to users, whether it's patients, clinicians, administrators, buyers, advocates, whoever is involved, because the problem has to be very real, right? And how do you know your solution set might work for them or would work for them? Well, If you're able and fortunate enough to get customers, they're going to keep coming back. Usage stays strong and they start talking, sharing their experience. And the people who buy the product believe it. They believe in the product. They probably believe in you, and they believe in the results, the deliverable. Success factor number 2, prove outcomes. The second thing healthcare startups need is proof. In healthcare, claims are easy, evidence is valuable. A company can say it improves access, reduces cost, or improves outcomes, but buyers want data. That's proof. They want to know whether the product actually helps patients, clinicians, or the business. For example, Omada has public outcome data showing meaningful improvements for members. That kind of evidence helps build trust with payers and employers. Another one, Oshi Health, another strong example. Oshi has published public data showing high symptom control, improved satisfaction, and cost savings in its hybrid GI care model. That is important because GI care can be hard to coordinate, hard to access, and expensive to manage. This is the key lesson. In healthcare, a startup has to prove that it changes something important. That could be a health outcome. It could be time to diagnosis. It could be patient engagement. It could be total cost of care. It could be clinician efficiency. There's so much more, but it has to be measurable. To maintain success here, build measurement into the product from the beginning, from the start. Do not treat outcomes as a marketing afterthought. Make them part of the operating model and make sure you understand it and how it works. And how do you know it's working? You can point to a credible, repeatable data that tells a buyer, hey, this works. Success factor number 3, build the payment model early. The third thing healthcare startups need is a payment strategy. This is where a lot of companies get into trouble. They build something useful, but they do not fully solve how the company gets paid. Healthcare is full of complexity here. The buyer is not always the user. The payer is not always the patient. The person who benefits is not always the person who pays. That can create a level of friction. So if a startup does not understand that early, it can end up with a product people like, but nobody can buy or buy at scale. Good example, Zocdoc. It's a company that got the business model right from the beginning. It has publicly said it became profitable, cash flow positive, and continued to grow. That tells us something important. In healthcare, the business model has to work. Growth alone is not enough. For startups selling into employers, payers, or health systems, this is critical. It's crucial. You need a payment model that matches the buyer's incentives. If the product saves money, but only in the long term, the buyer may be, they might still be a little hesitant. If the value is hard to measure, the sales cycle becomes even harder. To maintain success here, build the economics alongside the product. Make sure pricing, billing, and of course, reimbursement are part of the conversation from day one. And how do you know it's working? The company can explain exactly how it gets paid and why the buyer says yes. So are you seeing a theme here, right? Make it simple, make it effective, make sure you have all your ducks in a row. Success factor 4, make sure it fits into real workflows. The fourth thing healthcare startups need is a workflow fit. This may be one of the most underestimated parts of building in healthcare. A lot of companies think their job is to create something new. But in healthcare, the real job is often to make the existing system work better. If your product adds work, creates confusion, or forces clinicians to change too much too fast, adoption will suffer. It's just not going to happen. Even a brilliant product can fail if it's not easy to use in the real world. This is one reason Omada and Oshi are such strong examples. their design, their models are, I should say, designed to support care delivery, not just replace it. They work alongside clinicians and with real patient populations. That makes adoption easier because the product feels operationally useful. This is the question every founder should ask. Does this make life easier for the person using it? Now, earlier we talked about problems and how we address that. In this case, we take it a step further. Well, does it make it easier for whoever's using it? If the answer is no, that should trigger a redesign. To maintain success here, I should say, co-design with end users. Build with the people who will actually use the product. Test it in the workflow, not just in a demo. And how do you know it's working? Well, no surprise, usage is steady. Complaints are low. And the product becomes part of the routine. Success factor 5, scale with trust. The fifth thing healthcare startups need is trust. Trust is not a soft concept in healthcare. It is a business asset. Patients need to trust the product. Clinicians need to trust the data. Buyers need to trust the implementation. Payers need to trust the economics. And regulators need to trust the company's claims and operations. Again, Zocdoc is a useful example because its turnaround story shows how important credibility is. The company has talked about profitability, efficiency, growth, and provider scale. That kind of discipline matters because it tells the market the company is stable. Healthcare startups that scale too fast and without trust often run into problems. They overpromise, they underdeliver, and they damage their own brand. Now, once that happens, as we all know, it can be hard to recover. To maintain success here, be conservative with claims, be transparent with data, and grow only when operations are ready. And how do you know it's working? Partners want to stay with you. Customers renew with you. And the company's reputation gets stronger instead of weaker. So again, the 5 success factors. Here's the short version. A successful healthcare startup usually does 5 things. Solves a problem. It can prove outcomes. It builds the payment model early. It fits into the workflow, and it scales with trust. If a company can do those 5 things consistently, it has a really good chance of building something durable and sustainable. Failure 1, we talked about the successes. We have to talk about the other side of the spectrum. Weak validation, right? So we're now talking about failure. The first major failure pattern in healthcare startups is a validation that's questionable or weak. This is what happens when a company believes its product works, but the science, the data, or the workflow reality does not support that belief. We've all heard of or seen a company that believes so much in its product, they forget about all these things because now it's their baby. They have built something. It's new to them. They're hopeful, but hope is a bad strategy. What's an example of that? Well, that one of the ones that we all know a little bit about is probably Theranos. It's a clear example. The company became famous for claims about blood testing technology. But public investigations and reporting showed that the technology did not perform as promised. The company also faced serious regulatory and operational problems. That is why it became one of the most famous healthcare failures in modern history. And it stood out because it was deemed as one of the greatest successes until all of these things started lining up. The lesson is simple in healthcare. You cannot skip validation. If the product touches patient care, it has to be accurate, has to be reliable, and it should be defensible. How do you spot this failure early? Look for inconsistent results. Look for vague evidence. Look for claims that are, much bigger than the data. Failure number 2, no path to reimbursement. A startup can build a great product and still fail if it does not have a realistic way to get paid. This is one of the hardest parts of healthcare because the system, well, it's fragmented. The patient may want the product, but the payer may not reimburse it. The clinician may see value, but the organization may not budget for it. The employer may like the idea, but not enough to sign. Babylon Health is often used as a cautionary example here. It had major ambition and visibility, but its business model and operating reality did not align well enough with the complexity of healthcare markets. That kind of mismatch can be fatal. If you do not understand who pays, why they pay, and what value they get, the company is in trouble. So how do you spot this failure early? Watch for long pilot programs that never convert. Watch for weak buyer urgency. Watch for a sales process that sounds optimistic but never closes. All right? Failure number 3, sales cycle and short runway. The third failure pattern is the gap between long healthcare sales cycles and limited startup runways. Healthcare buyers move slowly. Procurement takes time. Legal review takes time. Security review takes time. Implementation takes time. That means a startup may have traction on paper and still run out of money before revenue becomes real. This is a common reason healthcare companies don't make it. They underestimate how long it takes to move from interest to contract implementation to payment. The startup might have a great product and a strong pitch. We've heard both of those things in our earlier examples. But if the runway ends first, none of that matters. How do you spot this failure early? Pipeline that looks healthy but keeps slipping. Deals that are almost there for too long. And a team that is burning cash faster than it converts customers. All of those make sense, right? Failure 4, poor workflow fit. This is a big one. A product can be impressive and still fail if it creates friction for the people using it. In healthcare, that usually means clinicians, care coordinators, operations teams, or billing teams. If the software slows someone down, creates extra clicks, or produces noise instead of value, adoption suffers. This is why the best companies often look simple from the outside. They are hard to build because they quietly fit into the system. So how do you spot this failure early? Low engagement, low repeat usage, frustrated users, or a product that only works in a controlled demo environment. Failure 5, trust and governance breakdowns. The 5th failure pattern, and it is a pattern, right, with trust and this governance issues. This can happen when a company overpromises, misrepresents results, lacks oversight, or scales too quickly without enough control. Again, Theranos is again the most obvious example, but Babylon also fits in a broader lesson. In healthcare, like we said earlier, trust is not optional. The entire business depends on it. A startup can survive a product issue. We can fix that. It can survive a market issue. Well, there's ways to adjust our approach to market. But if its trust collapses with people, with the market, with colleagues, internally, externally, the damage can be much harder to repair. So how do you spot this failure? Watch for hype that outruns proof. Watch for leadership that avoids hard questions. Watch for repeated gaps between what is promised and what is delivered. So, like we did last time, let's review very quickly the 5 failure patterns. Weak validation, no reimbursement path, long sales cycles with a short runway, poor workflow fit, and trust or governance breakdowns. So if I were interviewing a healthcare founder, these are the kinds of questions that I would want them to be comfortable with and able to answer. We're going to say it again. What problem are you solving and how big is it? What data do you have that proves it works? Who pays for it? And why do they buy? How does it fit into real care delivery? What happens when the company tries to scale? Failure side, what assumption turned out to be wrong? What did the company not understand about reimbursement? Where did adoption break down? Did the company have enough runway to survive the sales cycle? And were the claims stronger than the evidence? So you're hearing a lot of similar things, but at the end of the day, you want to be able to identify and list all the specific areas that support success and identify failure so that you can adjust accordingly. So let's talk about some of this episode's takeaways. In healthcare, startups win by being useful, measurable, payable, and trustworthy. That is the formula. Omada Health shows how evidence-based care can create value. Oshi shows how hybrid, multidisciplinary care can improve access and outcomes. Zocdoc shows how business model discipline and operational clarity can support scale. And Theranos and Babylon show how quickly things can go south when science, reimbursement, operations, or trust break down. So if you're building a solution in healthcare, the question is not just, can we launch? The better question is, can we last? So if this episode resonates with you, if being simple but direct and able to be effective is something you want to be, here's a potential go-forward strategy you may want to consider employing now. First, start with the problem or problems, define it, write it down, and confirm it with your team. Next, prove the value. What will your solution set do for the audience you're helping? If you're able, ask a potential client with what's their thoughts? How would it help them? And start to frame the market-facing language based on what they are feeling, what they deem as value. The next one, design around reimbursement. Make sure you know how you're going to get paid. And fit into the workflow. How will your solution support the workflow? Not necessarily change it. And grow only when the company can support the level of scale. If you do these things, honestly, you give yourself a much better chance of building something real, valuable to the right audience, and sustainable. So that's it for this episode of Healthcare Logic for Growth from Life Science Logic. Healthcare startups are hard because the stakes are high, but that's also why the opportunity matters so much and success is so rewarding. The companies that succeed are the ones that respect complexity and build with discipline and purpose. All right, thanks for listening. And if you want more information about today's episode, make sure to check out our show notes. We always try to give you references that you can look to. Until next time, take care. Thanks for spending time with me today on Healthcare Logic for Growth. If this episode brought you value, share it with someone in your network who's navigating their own commercial journey. I think they'll appreciate it. And if you have a healthcare-related topic you want me to tackle, leave me a note at eric@lifesciencelogic.com. Thanks again. I hope you'll join me on the next episode.